Assalamu alaikum dear doctors. In this video I am discussing a gastrostomy tube consent. It is a cerebral palsy or CP child need gastrostomy tube. So in this communication do not forget the stoma nurse. As usual we are starting by introducing and the agenda telling everything. Now I know you are such a keen ma'am. I know you are doing such a great effort taking care of your child. I know it is not easy to take care of a CP child, but you are doing your best. And I'm really admire your efforts. Oh, thank you, doctor. I'm here to take a consent from you to do a gastrostomy tube for Ali. What is it? So, gastrostomy tube, it is a tube from the skin outside to inside the stomach through which we can feed him and give him his medications. Look the drawing. This is a gastrostomy tube placement. We are marking the esophagus, that is food pipe, we tell stomach and the skin and the gastrostomy tube. We will draw these pictures during communication session when we are waiting outside. Is it a surgery? Yes. It can be done either by open surgery or a keyhole surgery. What keyhole surgery? It is an endoscopic surgery. Why he need this tube? So to be able to feed him and give him his medications. Is there any alternatives? When they ask about the alternatives of gastrostomy tube, we tell that NG tube will be alternative, but as you said that he pulling it out. Are you with me? Now about the drawbacks. Oh doctor, what are the drawbacks? So drawbacks of sleeping medicine, pain, bleeding and infections. Say the problem and the solutions. So when drawbacks they ask any station, we will tell that every procedure or every medication has some drawbacks, and gastrostomy tube has also drawbacks. Then we tell one by one and also the solution. Also there are temporary drawbacks. There is a risk of obstruction, but if this happen, first of all you will do massage of the tube between your fingers. If it did not work, you can get a 50 ml syringe and fill it with warm water and try to push and pull technique. If it did not work, you can use carbonated water preparations. After that, if still not work, you should seek medical advice immediately. Are you with me? Okay, doctor. Also, there is a risk of dislodgement, and if this happens, you will put NG tube in the opening, then go to the emergency room immediately. Am I clear so far? Yes, doctor. It may be there is a risk of leaking, but we'll use skin protection cream, and if still leaking, you should seek medical advice. Are you with me? Yes, doctor, but I do not know anything about how to take care of gastrostomy tube. You will not leave the hospital till we have a meeting with a specialized nurse who teach you everything you should know about care of the gastrostomy tube. Or how to feed him through this tube. We have two types of feeding, continuous feeding and bolus feeding. Remember, in gastrostomy tube there is two types of feeding. One is a continuous feeding and another is a bolus feeding. Now, continuous by using an electrical pump, allowing certain types of food to go into the stomach over a period of time. So, continuous is an electrical pump. Now, bolus. And bolus feeding by special syringe. You will put a semi-solid fluid and you will push it through the tube and then to the stomach. What about hydrotherapy? When they ask, hydrotherapy once the stomach be healed and he can be do hydrotherapy, take shower and swimming. How can I give him tablets through this tube? So tablets should crushed and dissolved in water, and after that can be given to him. Then at the end we summarize the everything what we tell, not everything, like the highlight point, and trusted website we give the leaflets and the support groups. So this is all about gastrostomy tube consent. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.